Hi y'all, this is Cindy, your sassy Southern grandma. I have mentioned on here before that I'm a nurse, and today we're going to talk about some practical tips for when you or your parents are in the hospital. Whenever you or your parents are in the hospital, there are some seemingly small things that are very important that a lot of people don't think about. We run into this a lot in the hospital, and so I thought I would give you all some tips. A lot of my audience is people my age in 50s and 60s, and also a lot of us have parents that are aging that end up in the hospital more than once a year or many times a year. So just a few things, just a few tips to make your stay or your parents' stay at the hospital more comfortable and easier to navigate. When you're in the hospital, it's a totally different environment. It's the schedule is not your schedule. It's out of your control for the most part, and it can be very disorienting. But a few things can help. One of those things is making sure that you or your parent have some of your personal items that you use on a daily basis. There's two different kinds of hospital admissions. You either have a planned surgery or a planned procedure like a knee replacement, a hip replacement, maybe a gallbladder surgery that was not emergent. It wasn't something you had to have done right that minute, but it was planned. So you know ahead of time. You can pack and you can plan for the things that you need. In that instance, be sure and think about things like glasses, readers, hearing aids, a cane or a walker, the things that you use to get around at home. Now the hospital will have walkers, but they won't be the same ones that you use at home. They may not work as well, or they may just work differently than what you have at home or what your parent has at home. So it's very important to think of those things that you really need. It is frustrating for us, and it's got to be frustrating for the patient when we have to yell everything at them. There are a lot of elderly people that literally can't hear if they don't have their hearing aid in. And we have to get right up to their ear and yell, and it seems very uncompassionate to me. It seems very obtrusive to come in and have to yell at Mr. Smith every time we need to ask him a question, or we need to tell him, I'm here to give you your medicines. This is what I'm here to give you. And they're constantly having to say, I'm sorry, I can't hear you, huh? And it's frustrating to us, so it has to be frustrating to them to have to be yelling the whole time.
I got the batteries to your hearing aid!
And also, it's a privacy thing, because even if you're in a private room, there's another private room very close by, and there's people walking in the halls that could hear possibly private medical information if I'm having to yell. And when I say yell, I mean literally. Some people we have to yell for them to hear what we're saying because they didn't bring their hearing aids, or the hearing aids got left at home by accident. But if you have a parent that's in the hospital, or you are in the hospital, have somebody gather up those things that they use every day. They're probably right there by their bedside table, or by the table by a chair where they sit. Pick up those things, hearing aids, glasses, readers. Those things are so helpful whenever we need to communicate, the doctors need to communicate. It's very confusing for someone to be in the hospital and not really understand what's going on because they can't hear or they can't see well. Also, the things like canes or walkers that you use at home, those things are so helpful when we take someone to the bathroom, to be able to have something that they're used to, something that they trust to get them from one place to another. Just makes the whole experience a lot more pleasant. So keep those things in mind. You may also want to bring some personal items, maybe a favorite blanket or a pillow. Hospital beds are known for not being comfortable. It's unfortunate, but that's normally the way it is, the way they're made, the way they can sit up and down. Seems like it would be comfortable, but a lot of times it's absolutely not what you have at home. And so it's important to maybe bring something of comfort to them, maybe a family picture, maybe something that would just keep them in mind that they're in the hospital, but family's not that far away. So just a few items to keep in mind. Another thing that we should all have is in your purse or in your wallet, have a list of the medications that you're on. Have the medication, the strength, whatever the milligrams or micrograms is of that medicine, and how often you take it. Please do not bring all of your medicines in a bag to the hospital. We will tell you to either take it back home, have someone take it back home, or we have to lock it up in the main pharmacy because those are things that belong to you. We don't want anything to happen to it, so we have them locked up in the main pharmacy. Any medicines that you need to take, the hospital doctor will prescribe for you, your regular medicines you take, plus any antibiotics or pain meds or anything that you need while you're there. So you don't need your actual physical medicines, but it's very helpful for the doctors for you to have a list of what you take every day. That way they can look at your blood pressure. They can look at what blood pressure meds you take. They can look at all the different things that you're taking and say, is this something they need to continue while they're in the hospital? I mean, if the doctor doesn't know you normally take a blood pressure medicine and your blood pressure is extremely high, they could order something that's not the best medicine for you because they don't know what you normally take. So it's very important for anybody who takes medications to have a little list of that in your wallet, in your purse, so that you can pull it out, keep it updated, because sometimes doctors discontinue things, and keep it updated to the most recent as you can, so that when you go to the hospital, the nurse is going to ask you, or the doctor's going to ask you, or pharmacy is going to come ask you, what do you take normally on an everyday basis? So keep those things in mind. Also, it's the age of the cell phone. It's very helpful for patients to have their own cell phone and charger. Hospitals do not stock every kind of charger there is. We may have some laying around that somebody left or something, but don't count on the hospital to supply your charger. You can usually get one in the gift shop, but it's best to just bring your own items. That way you can plug it in, keep it charged, and if anybody needs information from you while you're in the hospital, or you need to get in touch with somebody, you've got that there. None of us know phone numbers by heart now. We used to know them. We used to be able to rattle them off to our family, our friends that we call all the time because we had to dial it on the phone that a lot of people don't know about anymore. But we keep all that stuff in our phone now, all our contacts. So I've had patients that wanted to call somebody but didn't have their phone, so they couldn't call them because they didn't have the number, we didn't have the number. So that's a very important thing. And even older patients now know how to use smartphones because we've grown up with them. We've been acclimated to how to use them. And so it's something that's very important in someone's daily life. Plus, it keeps them in contact. You can FaceTime, help them feel less lonely while they're in the hospital, or you yourself. Let's also talk about some things not to bring. I thought it was common sense, but apparently it's not something that people actually think about. Think about what's in your pockets. Do not bring a pocket knife. Don't bring anything, any kind of sharp object, anything that might, probably anything they would take away from you at the airport. Don't bring it with you to the hospital. We've had people bring cartons of cigarettes. We've had people, believe it or not, bring a little case of those mini fireballs. Anything like that, any kind of vapes, any kind of tobacco products, any kind of lighters, anything of that nature will be taken away from you, sent to security. They lock it up, keep it with your name on it, you sign for it that they have it, and then when you're discharged, you get those items back. But it's a lot less stress on the patient and the staff, and makes things go a lot smoother if we don't have to deal with those non-necessary items. So just keep in mind, if you're going to the hospital, look in your purse, look in your pocket. What do you have with you? Is it necessary that you bring that to the hospital with you? If it's not something that you can use in the hospital, like cigarettes or alcohol or anything like that, any kind of what shall I say, drugs, any kind of non-prescription drugs, let's put it that way, that you might have on your person, don't bring them in the hospital. Leave them in the car, lock it up. Whatever you've got that you don't need to use in the hospital, be sure, just don't bring them with you. That way it goes more smoothly at admission and discharge for you. Another thing to think about is visitor etiquette. If you're visiting someone in the hospital, if your parent's there, and it's always nice to know what the visiting hours are. They're usually on a website, and anybody that works there can tell you. The hospital where I am now, it's 24/7. No limits. The only limits on visitors is they can't be under 12 years old. If they're under 12 years old, they are advised not to bring small children. Some people do bring babies in. It's kind of a journey place for babies, but that's something that people do. Sometimes grandma and grandpa wants to see the baby. So we don't really stick too hard on those things, but if it's an unruly child that's running around and making a lot of noise, we will ask them to go take them to the visitors lounge or something so that they're not disrupting all the other patients. But Be sure you know about visitors hours. Some hospitals have strict visitors hours like 8 to 8, but they will allow a family member to stay the night. It just depends on that hospital's policies, but be sure you know those and abide by them. It's uncomfortable for me and for a visitor to have to say, I'm sorry, visiting hours are over, you're going to have to go. I feel like I'm throwing somebody out, and I really don't want to, but that's just the way the rules are, so we have to enforce the rules. Also think about your length of stay visiting. It's one thing if it's your spouse in the hospital. It's one thing if it's your mother and she doesn't have anybody else, for you to stay basically all day and make sure you see the doctor and make sure, everything's covered. It's another thing if it's a friend from church or a friend you know from a club or someone you play cards with. Go have a little visit, maybe 20 minutes, maybe 30, and give them time to rest. I have seen instances where I remember one precious little lady that sat up in a chair because it was like she was entertaining her family. There were 15 or 20 people in there. They had brought a big, huge lunch for everybody to eat together. It was like a family reunion, which is fine, except this lady was on a heart unit and she had had heart issues and she really needed to rest. And it's difficult for us to say, you people need to get out. But she fell asleep sitting straight up in the chair because she was so tired from the illness that she had, but she wanted desperately to visit with her family. So just be kind and considerate about how long you stay for a visit. Also, any items that you bring as a visitor, ICUs do not allow any flowers whatsoever. Some people aren't allowed to have certain kinds of foods brought in. Most hospitals let you bring whatever you want as far as food for the patient. We can't really tell you, no, you can't have that bag of French fries. We can advise you that that's not best for what you have going on right now, but we can't stop you from eating it. But just be aware of those kinds of things. That person is there to recover. That person is there to rest, to heal. And it's hard to heal when you're having to stay awake all day long and all through the evening because people are visiting. If you are there with a patient if the patient themselves is someone who has dementia, it is very helpful for someone that they know to be there at different times during the day. You don't necessarily have to stay all the time, especially at mealtime. We have difficulty sometimes getting people with memory problems and dementia to eat hospital food that they're not familiar with. We don't know what they like, and sometimes they can't tell us what they like. But if a family member's there, patients now, if you haven't been in a hospital in a long time, patients now order their own foods. In most hospitals, you order your breakfast, lunch, and dinner. And if you don't order it, you don't get anything. So the nurse has to be aware if that patient's in there by themselves and nobody's ordering for them, we can order for them. And we do. But if there's a family member there that knows that person's food preferences and is there during mealtime, a lot of times those patients will eat a lot more and a lot easier if someone they know is there encouraging them to eat. If it's just us, a stranger they don't know, and they're disoriented about where they are and what's going on, they just won't eat. I've seen them go for a whole day and not eat anything because they just don't know anybody, they don't know anything, they don't know what's going on, they don't understand why they're in the hospital. Some of them don't even know they're in the hospital. So it's difficult to get them to eat, and of course nutrition is important for healing. So if you can, and I know everybody's busy, everybody has a lot going on, but if you have a patient with dementia in your family, if someone from the family could come, maybe just trade out every other day, every other meal, whatever works, for someone to be there for most of the meals to make sure that that person does get something they like and something that they will eat so that they can get that nutrition in their body. With visitors, it's also important to be sure you limit the number of people in the room at a time. Some hospitals have limits, but most hospitals will let you bring whoever in unless there's something going on that we need to ask people to leave the room. We will do that. But be considerate while you're in the room that if a nurse or a doctor comes in, kind of move away from the bed a little bit. Give them room to do what they need to do. Sometimes it's difficult to even get to the patient because there's people standing there right at the bedside and we have to say, excuse me, I need to get over there. It's just common courtesy to just kind of move to the side. We're okay with you being in there for most things. Sometimes the patient wants you to leave for certain personal things, but it's just common sense and courtesy to step out of the way so we can do our jobs and help get your person feeling better. And of course, keeping your voices low, keeping the volume down. Sometimes people will get several people in a room and there'll be a lot of laughing and talking, and that's great. It's good for the patient to have happy people around them. But we also have to remember there's other people in that hallway, and it can be disturbing to them if they're trying to get an afternoon nap and there's a party going on. We try to kind of remind people, let's keep it down a little bit. So if that would be helpful if people would realize that on their own. And as a visitor, also take care of yourself. Remember that that person needs to eat, but you also do too. You don't need to sit there at the bedside and not have anything to eat or drink all day because you're concerned and worried, and you're going to lose your energy. You're not going to be able to keep going, and they might need you by the bedside, especially if it's a critical situation. They might need you there, but you also need to make sure you're being taken care of. Go out, get some fresh air, come back in. You'll feel a lot better just moving around. It's really exhausting. I realized when my father was in the hospital years ago, when he first started having heart surgeries, that just sitting there is very exhausting, just sitting in the room. So get out, get some fresh air, go walk around outside. Most hospitals have little park areas or greenways that you can walk, and kind of clear your mind, get some fresh air and go out, get something to eat, get something to drink, have a bottle of water with you. Make sure you're taking care of yourself, because you can't be much help to that patient if you're not taking care of yourself. If you are the patient or you are the person advocating for the patient, and we are all four people advocating for their family member or their friend, whoever's in the hospital, if you have questions, be sure and write those questions down. If you need a piece of paper and a pen, just let us know. Just write things down, because the doctors round different places, doctors round at different times, different kinds of doctors round at different times. You may have a hospital doctor that comes around first thing in the morning, but your surgeon may not come back till the evening after he's done with surgeries. So if you have questions, whenever they pop up in conversation or you think of something, try and write that down so that when the doctor gets there, you know they're only there for a very, very short time. They have a lot of people to see. So make sure you have your questions at hand and written down, because inevitably you'll forget something, and then once the doctor's gone, you'll think, I should have asked them about this. So get a piece of paper, pen, write those things down for yourself or for your family member. Make sure you have them handy when the doctor comes in. That way they can cover everything they need to cover, and then they can answer your questions as well. Another thing to keep in mind is some people have very large families and spread out across the country, and we will get grandma's in the hospital and we're taking care of her, and we get 5 or 10 calls, I'm not exaggerating, in one day from a different family member, each time asking for an update. We have no problem giving updates, but every time we're on the phone talking to a different family member, we're not taking care of grandma. We're taking care of talking to you on the phone. So we can give you a brief update, let you know what's going on, maybe answer a couple of questions, but it's very helpful for us and for you to have one person designated as the contact person with the hospital. If there's a person in your family that's a nurse or a doctor or some kind of medical professional, that's helpful, because they can explain things to you better than somebody who's not a medical professional. But whenever you designate somebody, just have that one person, and then that person can text everybody else or call everybody else, or everybody can call them when they have a minute to get that update, so that we're not staying on the phone all day and having to answer. Because keep in mind, your grandma is not the only patient I have. I have 5, sometimes 6. So if I'm on the phone with 5 or 6 people from each family, I'm not getting the care done for my patient that I need to get done. We prioritize what that patient needs above everything else. So if you get a call, if you call and they say she's busy in a room but she'll give you a call back, just be patient. We will. And also, you can be a big help to us if you have a family member who's in the hospital and you see a change in them. If you walk in and start to talk to your family member and they're not talking the same way they usually do, or they are a little hesitant, or they are more drowsy than usual, or they're more, just anything different. If you see something different, a new tremor, any kind of twitch, any kind of change in their alertness or their ability to speak, be sure and point that out to us. We've never met your person before, so we don't know what their baseline is. We don't know how they are every single day. So if you come in and you see something markedly different in what you see every day, please be sure and tell us. I had a patient recently that in the morning she was very talkative and she was very engaging and had a conversation with me and with her family members. And then that afternoon she had taken a nap, and then that afternoon her visitors came back. I think it was her daughter came back and was visiting her, and she came out and said, "Mom's not speaking very well. She's not talking the same way she was this morning, and I'm concerned." And so I went in, did a little assessment, talked to her myself, and she was a little less alert. She was kind of slurring her words a little bit. So we contacted the doctor, and they did a stroke assessment and a stroke workup, did a head CT and all that. Everything turned out to be okay, and it may have just been a medication she had taken that made her a little less alert. But I was very thankful for that family member pointing that out to me so that we could get on top of it, because it could have been a stroke. It could have been something that changing in her situation that we needed to take care of. So if you see something different in your family member or your friend that's in the hospital, be sure and let the nurse know and just say, "I'm kind of concerned about this. Is that something we need to call the doctor about?" And nurses are really good about being on top of those things and being willing to call the doctor and get them to the bedside to look at your person. I hope that these tips have been helpful for you. I hope that you can stay out of the hospital and your family members stay out of the hospital. But if you're there, just keep these tips in mind. If there's other things that you found to be helpful when you've had people in the hospital, please be sure and leave those in the comments. It'll help other people that watch and read the comments. And if all this hospital talk is kind of too serious for today for you, check out this video about some Southern stereotypes. It's a little more humorous.
I'll come back now. Here.